So this is a very important video about the coronavirus that I want to share with anybody that's willing to listen and watch. So it's all about data. And here, for example, you see in today's news, the US coronavirus cases soar past 8,700 as officials, blah, 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 blah. Now, I'm all for the media reporting on progress and setbacks when it comes to something as important as this crisis. But here's my concern. Where is this data being gotten from? Who are they getting this data from? And what's the primary source of the data? And this is a data-driven conversation, because if you think about it, this data and these types of headlines are driving people's behavior and also setting policies that are going to have a long-term impact on ourselves as human beings in various ways, not just economically. So here's my problem. So I don't know whether this is the right number or not. So what's the most logical place that we should be getting our data from? It's the World Health Organization, not CNN. And here's where this thing really starts to frustrate me in terms of different reported numbers. So my partner in business, she's a mom and she has kids, and she's really concerned about the coronavirus. So what does she do? She goes and looks at the World Health Organization's situational reports every day to get a sense of the lay of the land. So today's situational report that came out is from the 18th. So when I go here and look at the situational report, I'm going to go to WHO because I think they're the most trusted source of data. Now, maybe that's not right, but that's where I'm going to go. It's their responsibility to report accurate numbers. Whether they are or not, and whether countries are participating, is a different argument. But let's just assume that the data here is right, that everybody is intentionally trying to update the WHO with the right information about total confirmed cases. So let's look at the US. As of yesterday, where is it? Yeah, there were 3,536 confirmed cases. Yet our friends at CNN, perhaps citing a reliable data source, say there's 8,700 and that it's soaring. So what is that going to do to people? Is it 3,700 or 8,700? So what we've been doing is we've been plotting through an open source, I guess, public data science project to try to sift through reality versus hype versus misinformation, et cetera, et cetera. So if I go and look at, and we're using WHO data, so here's some charts. And here's the coronavirus confirmed cases from WHO so far for these countries here. And what's the goal? The goal is to flatten the curve, because we don't want to be in a situation where we see the unfortunate circumstances happening in Italy, right? Okay, so who's flattening the curve and who isn't? Because we need to do country by country comparisons. And yes, people are going to say, well, nobody's really had all the tests done. It doesn't matter. What matters is you work with hopefully the data you have that's reliable, and it's from one source. We have to get together and rely on the World Health Organization to provide us with the truth, the most relevant, accurate, reliable data. Otherwise, any other piece of data is not reliable. And it's causing people to do things that maybe we needn't do. It's causing us to do things in terms of policy, in terms of shutting down borders and in terms of making people's lives perhaps more difficult than they need to. So let's look at this. So from February 2nd to March 18th, according to the World Health Organization situational reports, Italy is having a problem. We know that, unfortunately. Let's look at the US. The US is right here. Now, some people say, well, the US didn't report them because they were trying to change the optics, et cetera, et cetera. We need to deal with that, right? But let's just take it at face value that every country wants to solve this problem, learn from it, and then move on and make this so that we can learn from it and we can address this as a planet going forwards, because this is something that we all need to solve. So what are we looking for? We're looking for flattening the curve, right? So we see that with Iran, they had flattening the curve, or they didn't report. But again, let's get over this fact that maybe countries haven't reported and are starting to. So to those countries that haven't, report, put in system a reliable way to report. Anyway, so we had a flatten the curve instance here over one day. I think we've had some for the US, we had 35, 36 as of today, right? Plus they're flattening the curve in little increments. Here's the Republic of South Korea, right? So 82,000. So they flattened the curve, right? But they still have a lot of confirmed cases. So then what do? Well, we go, and after we have all this information and we can trust it and we have one reliable source, we start thinking to ourselves, okay, so what are all the countries that have flattened the curve and what have they done and when did they do it? And that's how we take this data, we share it with each other, and we start plotting other pieces of data on it. So for example, with Singapore, when did the mass testing start? Sorry, not Singapore, Republic of Korea. When did the mass testing start? We don't know. So let's plot it. Let's get together. There are tons of data scientists out there who can really provide the media and other people with right models. Let's look at the economics. But let's not, with all due respect to the WHO organization, let's not put data in PDFs. Let's put it out there so that people can do some modeling, so that people can contribute to decisions that are being made by politicians and make sure the media is reporting the right information. Now, if you want to get involved in this crowdsourcing project, all of this data is available online. We are adding in, as we can, the updated numbers for each country. Obviously, there's a lot more. These two were added by by one person because he learned about this crowdsourcing initiative. So help us out, or start your own, use a more sophisticated tool. I don't really care. What I care about is that we get the right information out there and that we start evaluating and analyzing that information in order to make better decisions, to make us feel better about progress when there isn't progress, for us to all pitch in to figure out how to make things better. And the ultimate goal is we can learn from this. We can become a better society, a better planet, and then we can apply the same sort of thinking to saving our planet and saving ourselves in other key things that socially need to be addressed, like climate change. So as difficult it is to know that people are suffering, let's try to turn this around into something that we can all make everybody better. Thanks for listening to this.